There's a kind of a theme here that many of you probably share with me, which is, gee, these are a group of folks who are really vulnerable, and we just got to get the job done. And I'm here to add one more barrier to why that's going to be so difficult. When you ask Americans about their willingness and commitment to helping others less fortunate, it's just an axiom of who we are as a country. What this shows you is kind of attitudes among all Americans, among Republicans, among high-income Americans and other groups, and it's about as close to universal as you can get. It shows basically majority support across all these areas. Expanding a government program for uninsured children, the idea that it's responsibility of the federal government to make sure all Americans have health care coverage. You'll see 55% Republicans support that, 65% of high-income Americans favor using tax dollars to actually pay for providing health care coverage. Again, majorities across the board. Even about paying more taxes, you'll find a majority of all Americans, 44% of Republicans, obviously not a majority, but I would say actually it's pretty interesting that it's as high as it is. I was frantically looking for data about non-governmental programs, and I couldn't find it, but I can tell you that for sure there's strong majority support for non-governmental efforts, volunteer efforts, community organizations, churches, and other religious organizations. But the basic point here, we're a compassionate country. It's well supported in our public opinion data. Okay, now that general inclination collides with this. Those of you thinking bipartisan solution, as one of my favorite gangster movies, Goodfellas, said, forget about it. It's not happening. This is one of many measures looking at political polarization in the United States House of Representatives and the U.S. Senate, and it shows you we're more polarized in Washington today than in more than a century. So when you look at the health care debate, you don't see perhaps more than one or maybe two Republicans supporting it, or you go back to the tax reforms under George Bush and you only saw a relatively small number of Democrats supporting it. That is the environment we're in. That is just the reality. The explanation, frankly, I hear so often in some of the popular commentary and, I don't know, conversations with my family over Thanksgiving, for instance, is that there's something profoundly flawed about who's in government, the kind of leadership we have today. And I can tell you that there's quite a bit of research and quite a bit of historical analysis that absolutely challenges this idea that somehow we're more enfeebled as a people today than in the past. But let me just tell you, Abraham Lincoln was the exception in his age too. And every age has an Abraham Lincoln. It turns out that it's really the environment that they work in that sets opportunities. Part of it is that our nominating system for selecting who runs for office was profoundly changed in the early 1970s, and the result was to empower party activists. We know quite a bit about them. We know is that the party activists in both parties are more extreme than the rank and file members of their party, and a lot more extreme than the most Americans, and particularly in some of that polling data I was showing you. The other is the kind of divides in public life have changed over the last half century or so, and you can kind of go back over the last 100 years, and you can see the shifting divides. And today we're divided over the role of government. A few decades ago it was civil rights, and this has really splintered our country, and the political parties are to some extent reflecting those divides. And one of the comments I hear a lot is, it's the media. They're the ones kind of hyping the divisions. They're kind of throwing fuel on the fire and so forth. And this is from a study that came out in a book I published in 2000 called Politicians Don't Pander. I'd love to tell you about that. But it's looking at national media coverage. And what we wanted to do was to look at the nature of press reports in terms of whether the press reporting on healthcare issues were focusing on the collective challenges facing our community, or if it was focusing on the political strategizing and the conflict. And what you'll see is that it's varied. It's gone up and down a little bit. In the late 1980s, you remember we had a big debate on catastrophic care legislation. It was passed, then it was repealed. So there was a kind of a bump there in the focus and strategy. But the first figure I showed about polarization taking off, well, that's what starts to happen in the healthcare debate by 1992, and it's continued. If we were to continue this this analysis, it would be continuing into our own age. So in other words, the debate about healthcare reform is occurring in a context that is, in truth, the most polarized we've seen in a century, and the press is reflecting that. It is not causing it. It is reflecting a profound change in our political environment, the nature of our political discourse. The second consequence is what all this polarization and its reporting and perhaps bit amplification in the media is doing to Americans. And to put it simply, it's scaring the out of them. This is kind of well known. This is from some Gallup data a few years ago, but it's well known. Basically, it shows that Americans are highly dissatisfied with the healthcare system's coverage, cost, and to a lesser extent, quality. Now, the reverse of that is also true, which is when you ask people, how about your own care, the quality of your care? How about your own coverage and the cost? And you'll see almost a mirror image of those numbers. That is, Americans are largely satisfied with their own personal situation, but they see the system as a whole as being really quite off-kilter. And both parties kind of battle to prime those different dimensions, and it provides a real opportunity for those who are opposed or have questions about health reform to unnerve folks. And that's more or less what we see. And taking that research we were doing looking at the media's focus on political strategy and conflict, and it's showing you the pattern of public support for the Clinton health plan back in 1993 and 1994. In about September 1993, there's about 60% of Americans who supported his plan. But also at the same time, the political system kicks into gear. You see this tremendous polarization breaking out, and the level of support that had existed begins to decline. By the time you get to the following year, there's only about 40% who support the Clinton plan and almost 60% who opposed it. Now, we know from the research we did that a lot of that erosion came from the fact that Americans became very concerned, worried, anxious about that personal dimension. The concern about how the system was doing, which is primed or activated by that focus on the national or common challenge, was diminished, and the concern about the potential loss was elevated. And that's precisely what we're seeing today. You have to think carefully about how to inoculate. This polarization is a contagion. So the question is how to manage it. One strategy is to focus on the frontline providers. And to some extent, what Michael's been doing, Scandrette, is precisely what you need to be doing. You need to be building these stakeholder coalitions with providers and with others. The affected population, that kind of compassion that I was talking about at the front, that is a very powerful resource here. The other strategy is the strange bedfellows strategy. It's very reassuring to Americans, and it's unsettling to the partisans when they're hanging out together, holding hands and supporting something. And so to the extent that you can put together a broad coalition from business and labor, from liberal to conservative organizations, from different parts of the health insurance, the groups that focus on those without access, that is a very powerful tool. The other is this kind of the framing of the choice about concrete, pragmatic challenges, that's obvious. The other is this kind of stage strategy, and I do agree with Lynn Blewett. I do think legislation will pass in Congress. The form will be more moderate than what we have now in the Senate, and certainly more moderate than we have in the House. My own side point on that is I think the public option is a major distraction from really what are the core issues, but I'm love to engage in that. But the point here is that I think some of the key issues about financing and about access that Lynn is thinking about and hoping for will be some of the things that really come down to the cutting room. I think the state cost sharing is going to be substantial, and that's going to be something to talk about. So, and I think it's very important, and you're doing it, which is thinking about how you set the agenda of the next governor. I work with a number of organizations and groups and communities, and they're all thinking about how to set the agenda, how to make the issue they're passionate about as the issue that the incoming governor will embrace as something they've got to move on. And that, I think, is really absolutely essential. I think most Americans are wrestling at this point with the challenges in their own lives. They remain compassionate, but they're very, very nervous and anxious about how they and their family are going to make it out of this trying time. And I think it's important to think about that in a fairly sophisticated and nuanced way.